months, we've been talking to you about different areas of professional development for RBTs. Of course, there's the new 2026 requirement that started in January, and many of you have already begun to implement those PDUs, whether you're doing them internally, having a BCBA deliver those trainings, or using an online product. And today, what we're going to talk about is prompting and error correction. But if you've missed our last several webinars, we've kind of covered all of the different content domains. And so you can go back, you can go to our YouTube channel and you can watch those there. You could also join our clinical leaders community, which launched April 1. And this is a place for those of you who are in roles of overseeing training, operations, quality, performance improvement initiatives, those types of things. You don't have to be a BCBA to join. We have people who are RBTs that are in a training position, but it's a community that's dedicated to those topics about clinical leadership, the kinds of things that often you find at only certain conferences or only a couple of sessions at our major conferences. And so every month we have a dedicated theme, and in the community you can earn BACB continuing education credits. You can, for example, in April, our theme was active student participation. How do you use ASR in adult training? This month, our theme is onboarding systems, looking at using a tool called journey mapping to look at how your onboarding is currently structured, looking at where you've got some friction points or where you've got some disjointments that you want to fix, and then coming up with an improved onboarding experience for new hires. In the community, we have people with different backgrounds that will contribute, as well as folks here at ABA Tech who will contribute. And we have a variety of different content that you can engage with, including several virtual, live events, Q&As, specialty deep dive sessions, workshops, those types of things. Which takes us to one of our sessions that's coming up next week. I'm really excited about this one with Dr. Cynthia Livingston from Monroe Meyer Institute on the man modality preference assessment. This is open to everyone. There's a link on our LinkedIn. There will be a link in our follow-up email for this session. If you're a member of the community, you can get CEs for it, but if you're not a member, you can attend. And I know that maybe man modality preference assessment, it's not the, grooviest title, the most enticing title, but it's a very cool assessment practice that can help you really look at communication preferences for both the learner and their caregivers and how the family is going to support communication. I was out at MMI last year, and several of Cynthia's students run projects on MMPA and similar methods. And it's really interesting to see how this as a tool can help you improve not only what you're doing clinically, but then also improve the buy-in from technicians and the buy-in from families on what they will or will not support once the child leaves the treatment setting. So I encourage you to join us for that session. And then this is a quick snapshot of some of the different topics we've talked about over the last several webinars related to professional development. A lot of them get pulled from our ProTech product, which is a online micro-learning product that goes over a variety of sort of review of basic concepts within each of these domains and advanced topics. And that's what we're going to dig into today. Each topic area, this is an example from verbal behavior. Each box represents short online practice sessions or practice lessons that technicians can access on their own time. It reviews, like I said, the light blue boxes are reviewing some of the basics. And then we get into more advanced topics like teaching procedures for verbal behavior. And there are a lot of video scenarios. They get a lot of practice. And then they get to take that short lesson and they get to apply it to a clinical case that they're working on. And there's a supervisor workbook that guides the supervisor on how to bring that lesson and content into a supervision session, how to set up practice opportunities. There's some procedural fidelity tools, those kinds of things. So if you're interested in the ProTech product and you don't really have a solidified PDU system yet for RBTs, I hope you'll talk to us and you can reach out to us. All that information's on our website. So that takes us to our topic today, which is on prompting and error correction. What we have to teach based off of the BACB test content outlined in the curriculum guide, and the kinds of things that relate to it, some of the things that maybe we aren't necessarily addressing in that initial 40-hour training. So I'm going to hand it over to Danielle to get us going on this topic.
Awesome. Thank you so much, Adam. And thank you, Maddie, for the introductions at the top of this webinar. So, before we dig into some of the specifics here, let's start by talking about some of the main ideas that we probably want to focus on when training prompting and error correction skills to our new technicians. And first is really like what these things consist of, right? What are prompts? What is an error correction procedure? So, for both prompting and error correction, we're going to define and describe these strategies kind of generally. Next, we probably want to provide some rationale as to why we use these kinds of strategies in teaching. And this can really help put prompting and error correction in a larger context of teaching for our new technicians, especially if we keep in mind that the vast majority of brand new technicians don't have experience in our field, right? Or they're at least are not required to have experience in our field. So this can also help us get some buy-in from them to implement these strategies. And then once technicians have this foundation, we can go ahead and teach them some basics about stimulus control. Now, we might not use those terms when we're teaching this to new technicians, but really what we're looking to teach is more specifically when we implement each tactic, right? Finally, and perhaps the most obvious goal of training is teaching technicians how to do these things, how to implement prompts, how to implement error correction procedures, what different prompting and error correction procedures look like in practice, when to implement these tactics, and then how to do so with accuracy. And we've kind of combined prompting and error correction in this webinar because what you'll see as I go through several of the next slides is there's a lot of callbacks between them because they are fairly similar and they do work together in conjunction in teaching. So, you can see this whole sequence that I just talked about reflected in this learner journey from our Prompting Pro Tech course. We start here with a basic introduction and rationale. So again, that why, right? Then we go into different specific types of prompts or error correction procedures. And we have our learners practice each repeatedly so they can directly translate these skills to their work with clients. I'm not going to go through all the little details in these journey maps that I'm going to show you for prompting and error correction today. There's extra stuff in there because our Pro Tech course is really targeted at a demographic that is technicians that have quite a bit of experience. So we're advancing their skills. I'm just going to pare this down to the basics today, but know that there's more extra stuff that's really cool in those courses. Okay, so we first teach technicians that prompts are assistance provided to help our learners respond correctly, and that this assistance must be feeded gradually to ensure that our learners can respond independently over time. Then we orient them to these two broad categories of prompts, stimulus prompts and response prompts, and we give them examples of what these are and what they can look like in practice. We also explain the rationale for prompting. So again, this why piece, right? Getting that buy-in. And you can see some of those reasons in the graphic on the left here. And then we briefly introduce the notion of errorless learning and errorless teaching. And pay attention, you'll see this come up again when I talk about error correction procedures. But that really kind of props up the rationale for why we want to prompt, when we prompt, and how we prompt. Then we revisit our three-term contingency to orient technicians to when prompts should occur, and we make this as concrete as possible. And again, you'll see this come up again when we talk about error correction. So here we're really emphasizing to them, prompts come up in that antecedent portion of our three-term contingency, usually immediately after an instruction. Okay, so we've really briefly covered the first three bullet points that I showed you all earlier. Now let's talk about this last one, the how we implement piece. And I'm going to show you how we've tackled this by choosing one specific prompting strategy so you can get a flavor for this. But know that we've covered many more different specific prompting tactics in our ProTech course. Okay, so we begin by teaching them the specific prompt strategies, such as prompt delays. This is what we've chosen just for today's purposes. And we do so by introducing progressive prompt delay procedures, then orienting new technicians to constant time delay procedures, each in isolation first. So we're defining and describing this separately. As technicians are learning about these procedures, they're kept engaged by activities that require them to respond before they can move on. And here's an example of a video that illustrates how we do that. So we'll just let this play through to the end.
Tiger. Yeah, that's it. That's a tiger. Zebra. Yes, zebra. Perfect. Snake. Way to go. That's the snake. Zebra. Yes, that's it. Tiger. Fantastic work, dude. Snake. That's it. That's a snake. Tiger. There we go. That's a tiger. Snake. There it is. That's it. Tiger. That's a tiger. Good job.
All right, so you can see that video really illustrates kind of ideal implementation. There was the delay of the prompt, so you saw the 0 second delay, and then she delayed the prompt. That was all explained to technicians beforehand, but it gives them a picture of like what should this actually look like when done in a clean implementation in practice. Then what we do is we compare and contrast these procedures, so the progressive time delay and then the constant time delay, before moving to some discrimination exercises to help ensure that technicians understand the distinction between the two procedures. And finally, we give them some non-examples and ask them to identify what was done correctly or incorrectly. So really starting to refine some of their discrimination skills here. So they've seen ideal examples, they're going to see non-ideal examples or non-examples, and be asked to discriminate between them. Okay, now let's move on to error correction. So you might have noticed here in our learner journey, this lesson starts with errorless teaching before we even describe different kinds of error correction procedures. Remember earlier I said, watch out for this. Here it comes again, right? And this is done by design because our ProTech lessons on prompting and error corrections might be thought of as companions. If you'll recall, we also briefly touched on errorless teaching in that prompting lesson as well when we were providing rationale for prompts, right? So it gives that kind of solid basis for why we want to implement these strategies and how they work in conjunction with one another. Additionally, the time points at which prompts and error corrections occur are at opposing ends of our three-term contingency. So contrasting them in this way can really help to solidify these discriminations for our technicians. So across these two lessons, prompting and error correction, we're teaching technicians that if we prompt well, we see fewer errors, which is always our goal, right? That's ideal. But errorless teaching is a bit of a misnomer because we know we can implement perfectly and still see errors. And our technicians, when those errors do inevitably occur, they need to know what to do in response to those errors. So while we do cover several different kinds of error correction procedures in our ProTech course, what I'd like to do now is take one example of an error correction procedure and walk through it. So the first thing we're going to do with each of these different error correction types is describe it for the technician. You can see that written out here. It's pretty brief. It's very easy to digest. It's in layman's terms. And then this is immediately followed by demonstration of the error correction procedure in practice so they can see what it actually looks like as is shown in this video.
All right, here we go. Touch the animal. Touch animal. That's touching animal.
So again, ideal example, clean implementation, right? This is the standard that we're really trying to train towards. Following the presentation of the video model, Then we can break the steps in the procedure down for technicians. And you can see these screenshots here. The way these are arranged in our prototype course is it's actually in a carousel that they have to click across, and it goes in sequential order. And that's how we really keep them engaged with this particular activity. And it's self-paced. So they move forward when they're ready. Then we move into some practice before introducing the next error correction procedure and requiring discrimination across all the error correction types. And that's kind of your framework that we follow throughout these lessons. All right, now let's talk about some broad considerations when planning to train the skills that we just talked about. So, as with all of the skills that we teach our new technicians, we really want to make sure that we train with efficiency, efficacy, and with maintenance in mind. So, our training really needs to be designed in such a way that it's fast, right? It works and it sticks. And just like with all of the other skills we've covered in our previous webinars this year, this is where I start to feel like a broken record. We also have to make sure that we're also meeting the ACB requirements. Now, we've highlighted one area here, but just again, like we've pointed out in all of our previous webinars, a lot of these items have crossover across different content areas. So that all needs to be considered when we're building these trainings or designing these trainings. And then again, from the perspective of a new technician, this is a lot of brand new stuff to learn. I've got both prompting and error correction on here. I've divided this kind of arbitrarily into theory and practice, but you can look at how long the list is across both these skill areas. And they're also learning at the same time about professionalism skills, about measurement and data collection, about verbal behavior and other expectations. And so you heap all of that on and you keep in mind, like, we're really expecting them to absorb all of this in a very short period of time. And this is a population that really might be contacting ABA for the very first time. So it's a tremendous amount of information that we're expecting them to understand and then implement with accuracy. So we really need to make sure that we're preparing technicians very, very well in training, and that's on us, right? It's not on them.
I just want to interject, Danielle, for a second to say this can become sort of your checklist here. And one of the things we'll talk about is training, sort of creating a matrix to make sure that your trainees have opportunities to apply all of these different skills within to different teaching programs in different contexts with different learners, all those kinds of things. But I think one of the things that we really try to do in ProTech, and you see on that list, on that error correction list, is we've watched a lot of organizations only teach one error correction procedure. And then it puts a lot of weight on the supervisor to modify that procedure and teach other procedures if that one that's taught in training doesn't work. So by teaching a variety of procedures, you can reduce sort of the on the job kind of teach and reteach that has to happen, increase the odds that for a wider population of learners, those procedures are going to work. And you give, by teaching multiple procedures, you embed some discrimination training for your trainee. So I just wanted to call that out. This could be sort of if you take a screenshot of this, your little checklist, you go back to your training and see if whether or not you're teaching this variety of topics in prompting and error correction.
I love that. Thank you for interjecting with that, Adam. I hadn't even thought about using it like a checklist, but this is why you are our instructional designer extraordinaire. So Adam will give you more gold nuggets like that when I'm all done presenting. But yeah, that's a great idea. So again, like I've said this before, again, I kind of feel like a broken record, especially if you've attended previous webinars this year, but I'll say it again here. To make sure that we cover all of the requirements that we have to cover in training and that our training is effective, efficient, and sticks, we really need to design training in a way that is standardized and replicable. And expectations really have to be very, very clear so that training and performance expectations can be aligned or wrapped around what's happening in training. You don't want to have large discrepancies between what you're doing in training and then what technicians are actually going to contact out in the field. And we need to build our systems, right, around supporting these expectations because that's going to ensure consistency and sustainability. And I'm only going to cover one common challenge here because I think when we're thinking about prompting and error correction procedures, um, one really is going to stand out, and that'll become obvious in a moment. But I will emphasize again that the quality of our training really, really matters a great deal because when training is done well, we can probably avoid or at least minimize a lot of the common challenges that our new technicians are going to encounter once they find themselves in chair with our clients. And this is the common problem that I think probably everyone thinks of when thinking about implementation of these kinds of teaching strategies. So, if you attended again our webinar last month, you might be looking at this and thinking, this is the exact same slide she showed in the exact same section of the presentation, and you're right. But I left it in here because this really does tend to be that most common problem for our technicians. This is hard, right? They're thinking about a gazillion things happening at once. They're trying to digest all of that information we talked about before, and they're trying to apply it in a context that they've never worked in. Um, but this problem also has the most impact, right? And we need to make sure that we're ready to deal with it. So, if we don't train our new technicians well from the outset, and if we don't provide clear, technologically sound procedures for our technicians to follow in teaching, then we can't actually determine if our interventions are having their intended effects. So, train with this in mind as well. So you have to make sure that we're conducting systematic integrity checks and that we're doing so frequently. Here's just an example of how you might do that. Organizations have varied systems for this. Checklists look different. That is absolutely fine. But we need to be conducting these checks to make sure that we know how we identify drift and that we know how to correct that drift when we do detect it. And I would argue that this needs to be done before any other change to programming is made. All right, now I will pass it back off to Adam, and he's going to go ahead and drop some genius nuggets the way he does every webinar, the way he does in every conversation I have with him, anyways. And he'll talk about like what to consider more specifically in training or when you're preparing training for technicians.
Great. Well, thanks, Danielle. There was very nice coverage of these two topic areas that are pretty big. And sometimes we don't think that they're very big because we put more of our focus on the teaching unit, which is either like the discrete trial or the learn unit. But this is a lot, and it's actually a very tricky area to design training for and to train people on. And just like Danielle was a broken record, I will also probably be a broken record because many of the strategies that we talked about over the last several webinars apply here. The one difference, though, in when we talked about verbal behavior, we talked about the importance of having some conceptual training in there, helping trainees make discriminations between different verbal operants and key features of key features of what makes one operant that operant and not another operant. The difference in prompting and error correction is that you are often teaching a chain, and it's a chain of responses that happen in quick succession. It does involve concepts, and they are applying principles about, knowing when to fade or the number of opportunities that are delivered at a given prompt level, all of those kinds of decisions that people have to make. But it also happens so quickly, it's so motorically locked together from delivering the SD to putting that prompt right against that SD unless you're using a time delay, and then so on through the unit. So one of the strategies that I wanted to put in here for when you're thinking about training this is to integrate prompting and error correction into the same training and making it part of the same, show that it is part of that same learn unit. And you heard Danielle talk about that a little bit, which is why we combined this webinar. But sometimes we've looked at people's trainings and they'll have a whole training session that's just on error correction. And the problem sometimes with that is one, that it overemphasizes error correction or prompting rather than being integrated, which can then lead technicians to believe that error correction is something that is more heavily weighted than doing errorless teaching with the prompts up at the beginning. The other thing is that it can become very confusing. And you heard Danielle say they're learning a lot of content in a short amount of time. And now we're going to have two separate trainings on a lot of different things that not only they're going to have to discriminate different prompts and different error correction procedures, but now they're going to have to go to get and put it in this seamless chain with a learner, and they're going to have to respond to that learner's behavior. So the first big thing is to look at how you're training both of these and to bring them together and teach them as a seamless movement, if you will, rather than having them as separate procedures, because that'll help begin to integrate the decisions around that. Things like when you represent, especially if your error correction procedure involves going back and representing the SD alongside of a different prompt that was originally presented in the initial delivery. So that is one thing to really consider is whether or not you integrate the two of them so that it's a lot easier to consolidate for the trainee and they can begin to apply it. Okay, so now the second one is to practice prompting and error correction around a group of programs rather than on a single program. So in addition, the first kind of tactic here about integrate or suggestion around integrate prompting and error correction to the same learn unit is that not only do people train it separately as two separate things rather than integrated, they will also get trainees to practice using prompts or error correction on the same target in succession rather than having them rotate between programs. Okay. And so they are not intending for they're not intending for trainees to go out in the field and do a lot of mass trialing, maybe, but they end up teaching that by virtue of in practice, having them continually repeat the same target with a prompt or an error correction. So when you set up a role play, and this is true of if you use role plays during competency assessments, make sure that you rotate multiple programs that are going to account for the different types of prompts across different types of programs. So don't just have a bunch of tacting programs. You saw that one example where there were a lot of, there was a lot of listener responding, I think in an earlier example. Okay. You want to now bring it into a scenario where they're going to rotate listener responding and some imitation and some tacting and some echoics. Okay. So that they can start to begin to track in their mind different programs that they're having to rotate between. And remember that prompts and error correction are assigned to those different programs. So if I am using one prompt level on this program, I'm going to stay there when I come back to that program. Okay. And it helps them avoid some of those issues that come up in mass trialing. All right. And then the third suggestion is really to focus on not just building familiarity with these procedures, but really building fluency, making sure that people can deliver trials very quickly, and not only deliver trials quickly, but deliver it using prompts and error corrections and being able to respond to the learner's behavior in the moment. Because in the moment, you do have to provide a lot of it's a lot of think on your feet. It's fast, flexible decision making. Even when you've got a really nice outlined procedure, or you've got a universal protocol and you've got it taped up on the wall right in front of the technician, there's a lot in the moment that's happening. There are subtleties to every learner that you're you're becoming responsive to. And so as quickly as you can, getting technicians to practice the integration of prompting and error correction is just as quickly you want them to become attuned to the subtleties that are going to be in that learner's responses. It's like indicating responses, okay? Indicating responses, all learners have them, but they are different based on the learner. Sometimes their indicating response could be a subtle change in eye gaze, okay? Well, the same thing can happen in watching and being responsive to the learner's subtleties that would then cause a technician to prompt when they shouldn't or deliver an error correction when they shouldn't or when they should. So you want to make sure that you get them fluent enough in implementing the procedure that now they can really start to be responsive to the learner and not as dependent on some type of job aid or diagram that's showing them that progression. The same thing can happen with digital data collection platforms, is that a technician, one of the faulty features of some ways that data collection is set up is that it will not show you, if it has a bunch of buttons for different prompts that were used, but it won't show you the last prompt that you use. You'd have to click into a couple of different menus to see it. And the problem with that is that it really slows down your trial counts. And then it's also difficult if you're rotating programs to remember where you left off on the last time you ran that program. And so not only can technicians become dependent on job aids, they can also become dependent on those kinds of cues from the data collection system. And so interspersing trials with prompting and error correction should be a really key goal here. A strategy or two strategies you can layer on top of them is a strategy called talk aloud, another one called teach back. And we've talked about these in some of our previous webinars. Talk aloud is just as it sounds. As I'm going through this procedure, as I'm implementing this thing, I'm talking aloud. I'm telling you what I'm doing and why I'm doing it. Well, the same should be true in behavioral skills training. You're not just providing instruction and then a model, but you're providing a model where you are saying on top of, I'm delivering the SD, I'm waiting 3 seconds before I prompt. Okay, look at the learner's response. Now I'm going to do X or I'm going to do Y. Okay, and then when you start having the technician implement it, have them do the same thing. Talk aloud to say what I'm doing, tact the SD, the prompt, the learner's response, how they're consequating, what they're going to do next. Have them pause, tell you back what they're going to do on that next trial. Okay, sort of a think before you do. All right. Similarly, you can use a teach back procedure, and teach back is basically, we showed a video of a nurse giving information to a patient and the patient teaching back in their own words what they're supposed to do with an inhaler. Well, the same is true here. If I describe an updated procedure to someone, if I go back to one of Danielle's earlier slides with the different kinds of error correction procedures, I may have taught in upfront training the remove and represent or control error statement procedures, but I didn't teach some of these other ones, and that's fine. But we've got a learner where maybe one of these other strategies would be helpful. Well, I have a technician now who has experience having used error correction procedures. So I may not need to go through a whole behavioral skills training sequence, but I could really just say, you know what? Here are the three components of this error correction procedure. This is what it would look like. Let me just show you real quickly. Here we go. Now I'd like you to tell me back how that procedure would run. Ooh, let me give you an example. Now you apply it to that. Let me give you another example, apply it to that. And it's a very efficient way to check their understanding and increase the odds that they will go into practice and implement it. And it also tells you if they can't explain it back accurately, that you may need to go in there and provide higher level support. Go in and do some behavioral skills training. Okay. All right. So fifth suggestion here is to make prompting hierarchies visible when you first start having people collect data. So I mentioned this already. One of the big problems with the data collection, some data collection systems, is that they've got buttons where you'll click to collect data on a given program, but it won't show you the whole sequence of previous targets. You'd have to go over to a target list. You have to go over to the graph and look at that, okay, which slows down the trial count. But when you're training data collection, one of the things you want to try to do is, if you've got different rules that trainees are going to provide in how they deliver prompts and error correction procedures, you want to make that visible. This is an example of doing that. This is a data sheet from a training we designed where we've set up three. I'm only showing you program A, but we're having the trainee rotate three programs. Okay, so this one's showing a match to sample, but there are two other programs in two separate columns, and for each program there's an assigned prompt hierarchy. And in gray, we've got the prompt hierarchy outlined. Okay. Over top of the gray, the technician has this sheet in a plastic sheet protector, and they've got an expo marker. And they're going through the role play. And as they go through the role play, they're indicating what prompt they used. Okay. So I used a positional prompt and the learner got it correct. So P with a plus. Now they rotate to program B, then they go to program C, and now they come back. And in this training, we taught them, if the client emits a correct response at a given prompt level 2 times in a row, then you can fade down. Okay. So then what we want to do is, in this data sheet, we are leaving a permanent product behind. We're giving them the paper trail to show them you did 2 positional prompts. There was a correct error. There was error the second time. Let me pause you before you run the next trial. What should you do next? Okay, you went up to a gestural prompt for the error correction. You see that EC there for error correction. You went up to a gestural prompt, so you should stay there. You're going to run the next trial at a gestural prompt. Okay, great. Now we've had 2 correct responses emitted at gestural. Now what do? Fade down, okay? So if we go back to our strategy around talk aloud and teach back, this is a great way to do that. Okay. The one challenge with prompting and error correction, even when you've got a data sheet where you've got open boxes and people are writing plus, minus, is it doesn't really show them the progression easily enough. Okay. It doesn't show them the hierarchy easy enough that they can like scan and make a decision about what they should do next. So if you can make it visible, then you can show, oh, look how integrated and streamlined prompting is with error correction. Okay. And then what you can do is in subsequent role plays, and then once you're actually putting the technician with the client, now I can fade out those supports. All right. You're becoming more familiar. You're becoming more agile with implementing this procedure. Now we can remove all of these, we can remove the grades. We can just give you a box where now you're going to have the prompt hierarchy written at the top of the data sheet. And now you're going to go through each of the trials and you're going to mark correct and then the prompt level. Okay. All right. And then we've got the last one here, which is to use a matrix to find procedural fidelity opportunities. And what I mean by this is we've taught, let's say, a bunch of different prompting and error correction strategies. Okay. Maybe we've taught all these different things. Now, as a supervisor, you say, okay, this trainee is going to be working with these two clients. These two clients have these various programs. Okay. It's like matrix training, but for the technician. All right. Okay. So they've got these various programs. These various programs use these various prompting and error corrections procedures. Now, what I want to do is find opportunities within sessions and across the day, if I'm there for the day, in a clinic, let's say, and I want to map out my observations so I can do procedural fidelity checks across those different procedures in those different contexts. Because there is a difference on how easily someone can apply certain prompting and error correction procedures when they're seated in like structured teaching versus incidental teaching. Like if we're walking to the bathroom or walking to the gym. Okay. Those are contextual variables that do impact how easy or difficult it is to implement prompting and error correction. Okay. Not only because you're on the move and it's harder to collect data, but also there are a variety of distractions. If you're doing incidental teaching and you're using prompting and error correction and you're not super familiar with it, you're not firm in using those procedures accurately, it's actually very distracting because you're going to be walking by other technicians with other learners who are going to also be setting up incidental teaching opportunities. Like, let's say hi to this client that you're working with. So there are a lot of distractions that happen. And that's where you start to see a lot of prompting, error correction, learning opportunity arrangements. You see a lot of that drop off. You see a lot of errors. And through that, what ends up happening is that because technicians aren't using it consistently across the day, across learning opportunities, across teaching contexts, then they start using it in certain contexts, and then the child becomes really prompt dependent in teaching. Because now teaching has stimulus control around it, which is like, oh, teaching is only this thing where I'm seated across from the learner, rather than something that happens throughout the entire day. Okay. So there is both prompt dependency that happens because of the staying too long on a prompt and all the various things, even when you're doing it right. And then there's prompt dependency because of poor procedural fidelity of the technician implementing the procedure. And the other thing that can happen is that sometimes when people are really not very firm in using prompting and error correction consistently, is that they don't attend to changes in the child's motivation in the learning context. And so they will prompt in situations where they shouldn't, okay? They should instead be trying to capture and contrive motivation. So they should be changing reinforcers, all those kinds of things, okay? So all these variables, the reason we're kind of talking about this is because all these variables surround the issue of getting technicians to effectively use prompting and error correction. Okay. There's the implementation of those strategies, and then there's everything else that surrounds it. And so setting up that matrix can really help you look at those features and make some decisions about how you're going to arrange it. Okay. All right. So this is sort of the summary of those strategies. All right. First is that when the moment that a technician walks in, we orient them to this learn unit, okay, or the discrete trial, the 3-term contingency, okay. We talk about how that unit changes in size based off of what you're teaching and the skill level of the learner, Okay, earlier learners who are working on more discrete responses are going to have smaller learn units than learners who are working on longer responses, chains, and task analyses are contacting feedback, contacting reinforcement after a longer period of responding. Okay, so you want to help them size up that unit and look at where prompting and error correction fit inside of it. Okay, and then you want them practicing it very early on by rotating through programs rather than getting stuck on doing it with just an individual target. Really getting up their speed and accuracy with that. And you can, one of the ways to firm that up is by using talk aloud and teach back. Those are two strategies you can use to firm that up. And then as you're doing this, the other thing in the other kind of performance support you can provide are these kinds of cues that are going to set them up to implement this effectively, fade where appropriate, until they can do it really independently across different contexts. And you'll know that by setting up your matrix to say, I need to collect procedural fidelity focused on teaching units across these different contexts, these different targets, and so forth. Okay. So prompting and error correction, it is quite tricky to teach because there is judgment that people have to apply in the moment. And you're going to be doing so much of this. You should be setting up so many trials throughout the day, throughout a session, that you're not going to be able to observe all of them. That's one of the things that makes it very difficult from, let's say, supporting a learner through a feeding routine that only happens twice in a session. Okay. This is happening all day, every day. All right. And back to that point, one last point on fluency is that one of the key reasons that you want them to be implementing prompting and error correction effortlessly is because error correction specifically becomes higher stakes when the number of trials per hour are low. The lower number of trials in a given teaching session, that what I mean by high stakes is that it really matters that the technician is effectively using the right error correction strategy and the right prompting, because it means that the learner's only contacting that learn unit and reinforcement on such a infrequent basis in the larger context of the session. The more trials presented, the less you have to worry about some of those features, as long as not every response is being prompted. Okay, so it's something to think about as you both are providing supervision on this particular issue on its own, and as you're thinking about the ways to structure the session, and sometimes the kinds of errors, just like a common phrase we say is the problem that presents may not be the problem that be. Okay, which is to say the problem that's right in front of you, the cause of it may not be what you think it is. All right. And problems related to people not effectively using prompting and error correction may not be related to them not knowing how to use it, but it's because they have so few learn units per hour, or that the environment is not enriched enough to prompt enough teaching opportunities, that then they really are not getting enough practice with implementing this. So you both want to think about it from the vantage point of the technician, and then also flip it over, of course, to the side of thinking about it from the learner. All right. So we want to thank you for being here for our webinar today. And we hope you got something useful from this. We encourage you to join the Clinical Leaders community. It's $150 for the year. You can earn up to 16 continuing ed credits for the year. Although I think next week we'll meet 16 credits. There are already 16 units in there. We've been open just a month. So we plan to have many more in there. It's also a really good way to talk specifically about your organization, talk about things that you're doing in training or developing systems, or coming and bringing to the community a clinical or a performance problem that you're having, and help brainstorming with us using some of the content that's in there to help you kind of solve and think through problems. So we encourage you to do that. You can learn more on our website, and there'll be a link in our follow-up materials. Contact us, of course, about any of our RBT solutions, from our 40-hour training to our ProTech. to BCBA CEUs. We've recently migrated to a new learning management system that allows for all of these pieces to be really well integrated, for us to create custom learning paths for you and your organization, to make, have one house where you can put all of the training and put all of the required pieces that you've got separately from what we offer. And then we, of course, encourage you to look out for our next webinar again next week, free event. Dr. Cynthia Livingston talking about the man modality preference assessment. We're going to walk through a case showing you how to use this, and we're also going to talk about what happens when the learner's preference for a communication modality differs from that of the caregiver, and what do you do in those situations. So thanks so much for being here, and we hope to see you again soon.